Peptic ulcers are open sores that develop on the inside lining of your stomach and the upper portion of your small intestine. Peptic ulcers include gastric ulcers that occurs on the inside of the stomach, and duodenal ulcers that occur on the inside of the upper portion of your small intestine, or duodenum. The most common causes of peptic ulcers are infection with the bacterium Helicobacter pylori or H. pylori, long-term use of nonsteroidal anti-inflammatory drugs or NSAIDs, such as ibuprofen and naproxen sodium. Stress and spicy foods do not cause peptic ulcers, but can make your symptoms worse. What are the signs and symptoms of peptic ulcer? The most common peptic ulcer symptom is burning stomach pain, feeling of fullness, bloating or belching, intolerance to fatty foods, heartburn and nausea. You may have an increased risk of peptic ulcers if you 1. Smoke. Smoking may increase the risk of peptic ulcers in people who are infected with H. pylori. 2. Drink alcohol. Alcohol can irritate and erode the mucus lining of your stomach, and it increases the amount of stomach acid that's produced. 3. Have untreated stress. 4. Eat spicy foods. Spicy foods irritate your stomach lining and may worsen your ulcer. Peptic ulcers can result in internal bleeding. Bleeding can occur which can lead to anemia or a severe blood loss that may require blood transfusion. A hole or perforation in your stomach wall. Peptic ulcers can perforate the wall of your stomach, putting you at risk of serious infection of your abdominal cavity or called peritonitis. Obstruction. Peptic ulcers can block passage of food through the digestive tract, causing you to become full easily, to vomit and to lose weight. Gastric cancer. Studies have shown that people infected with H. pylori have an increased risk of gastric cancer. Prevention of peptic ulcer. Protect yourself from infections such as H. pylori by frequently washing your hands with soap and water and by eating foods that have been cooked completely. Use caution with pain relievers. Take your pain medications with meals to reduce your risk of stomach problems. You may need to undergo diagnostic tests such as H. pylori breath test. The test is to determine whether the bacterium H. pylori is present in your body. Endoscopy. Using the endoscope, your doctor looks for ulcers using scope to examine your upper digestive system or called endoscopy. Treatment involves killing the H. pylori bacterium if present and eliminating or reducing use of painkillers like NSAIDs and helping your ulcer to heal with medication. Antibiotic medications to kill H. pylori. These may include amoxicillin, clarithromycin, metronidazole and tetracycline or as prescribed. Medications that block acid production and promote healing. Proton pump inhibitors reduce stomach acid by blocking the action of the parts of cells that produce acid. Examples are omeprazole, lansoprazole, esomeprazole and pantoprazole. Medications that reduce acid production. Acid blockers, also called histamine or H2 blockers, reduce the amount of stomach acid released into your digestive tract, which relieves ulcer pain and encourages healing. Lastly, antacids. They neutralize stomach acid. Antacids neutralize existing stomach acid and can provide rapid pain relief. Thank you for watching. Please like and subscribe and click the bell icon to get new video updates. Goodbye.